Welcome to the Natural News Talk Hour. I'm your host, Jonathan Landsman. Our show today, an allergy alert, causes and solutions. Our guest began her studies at Louisiana State University, where she majored in microbiology and nutrition. She went on to earn her bachelor's degree in biology from the College of Charleston in South Carolina, and later received her doctorate of naturopathic medicine from the Southwest College of Naturopathic Medicine in Arizona. In 2011, she moved from Raleigh to practice medicine at the Riordan Clinic in Wichita, Kansas. A fourth-generation doctor, but the first in her family to pursue a naturopathic medicine, our guest strives to find the root cause of many medical problems. If you suffer from allergies, you're not alone. Millions of people suffer and find no relief from conventional medicine and its pharmaceutical interventions. Today, we'll expose the true nature of allergies, its cause, and some solutions. Please join me in welcoming Dr. Jen Kaumeyer to our show. Dr. Jen, welcome.
Hi, Jonathan. Thank you for having me on your show today.
This show is for educational purposes only. Always consult a trusted healthcare provider for medical issues that concern you and make an informed decision. For more information about Dr. Jen or the Riordan Clinic, visit riordanclinic.org. Dr. Jen, I think a good place to start would be just to simply define, in your eyes, what allergies really are.
So, Jonathan, allergies are a damaging immune response by the body to a substance. Allergies occur basically when the immune system is imbalanced and excess inflammation is produced. We always have inflammation. We can't survive without inflammation. But allergies occur when our inflammatory system has gone haywire, excessively inflamed.
I think sometimes, Dr. Jen, it gets a little strange when, and I do this on purpose. I mean, I'm not kidding around, but I actually like to throw out to people. I think a lot of people associate allergies with like sniffly nose and watery eyes or clogged ears. But, you know, allergies or allergic reactions can really run deeper. Isn't that true? It shouldn't be such a narrow focus that I think people tend to do without much thought. Don't you think that's true?
That is true. I mean, the common symptoms, Jonathan, of allergies are runny nose, itching skin and eyes, hives, food allergies, eczema, asthma. But you have to, if you look at all those common symptoms, they are occurring in the organs of the body that are considered the excretory organs, or the organs where we excrete toxins. And so when we're overly inflamed or our immune system is attacking something, it then tries to get rid of it, whatever it is. And so allergies are just a symptom of the body trying to get rid of it. So it's actually your body producing the symptom to start healing. So it's almost it's a healing symptom in a sense. But that's why you have those symptoms. It's the body getting rid of the toxic exposure.
Now, you and I have never talked about this before, and I want you to be honest on the program, but I always like to talk about emotions as well because I don't see how you can separate physical dis-ease or even physical wellness with whether somebody is emotionally like really out of whack, like we're talking about agitated, easy to get angry, overly excited and just, irritable, to those people who tend to be very calm, cool, and collected, even in very stressful times. Wouldn't you say that almost in a sense, these symptoms that you're talking about, where someone seems to always get very angry or upset about things all the time, that probably is a sign of some physical inflammation and sort of like a way of them releasing all that pressure is through their emotions as well? That would almost be like an allergy too.
Absolutely, Jonathan. Emotional toxins, relationship toxins, all these sort of toxins create inflammation in our body. It changes our hormones, our cortisol, our insulin levels, and they all create that inflammation that then the body has to get rid of. So when people that have allergies, and I do want to make a point that not everyone has allergies. I think a lot of people think everyone kind of does because it's so common. But people that have more toxins, so you have to look at the emotional side and relationships as well, are going to have more allergy symptoms. So it's a combination of a lot of things. It's not just looking for one thing that's creating the symptoms because it's never one thing. It's always a combination of many things in our lives that create the inflammatory response that then manifests as allergy symptoms.
And that leads me to something else I really want to get into. And I find this, I guess the best way I could characterize this, Dr. Jen, is it's kind of sad when I talk to people who might be experiencing cancer. I mean, really serious health problems, right? And they view it as so separate from everything else. And I'll bring up something like, digestion, or how's your elimination, or is your doctor talking to you about ways to improve your gut health? And they really get thrown off by that. They say, they literally say many times, what does my digestive system have anything to do with this cancer? Would you stay on topic? So I'd like you to sort of draw this connection, if you will, between allergies and gut health. Is there a connection? And if so, how, in your opinion?
That is a very good question. And, the reason why doctors used to look at the whole body when they treat it, but nowadays they don't, because everything is kind of piecemeal. We forget that our whole body works together. Every organ system works together to create our bodies so that we can work efficient. So everything kind of starts with what we put into our mouths, because our bodies digest our food, we go through absorption. Everything we eat is how our body builds itself. We couldn't survive without food and water. We can survive for a while because the body will break itself down, but everything in our body relies on what we eat. And if our digestive systems are not functioning well, a lot of things will go crazy. And the first thing to happen is excessive inflammation. And usually excessive inflammation will start with symptoms such as your typical allergy and asthma type symptoms and eczema and things like that early in life. So what people don't realize that in our GI tracts, in our guts, that there's so many amazing processes happening. The function of the GI tract is what's important. Doctors go in and we look at the structure and we do biopsies, but they're not analyzing the function. So how we're digesting, which is breaking down our food, how are we absorbing it, which means bringing it through the cells of our digestive tract into our blood. And what a lot of people don't understand is that the majority of your white blood cells, which are your immune cells, are actually made in the lining of the gut. And if the inflammation in our guts are overly inflamed and our guts are swollen and our cells are not glued together properly and things are leaking into our blood undigested, then we're going to have inflammatory reactions. The cells that are in our gut are not going to get the right nutrition for our white blood cells to properly replicate and to properly do their job. So when our guts are not healthy, when our acid in our stomach is not at the perfect pH level, when our pancreas is not secreting, the right hormones, the rest of it's like a domino effect happens, and it takes a long time, over the course of several years, but it starts early on in life. If our guts aren't functioning, we're going to have excessive inflammation in our body. And that can manifest, every person is so different, we're so unique, that it can manifest differently in different people. But anything usually with the ending of itis, can happen when our guts aren't working. When I see people with dermatitis, colitis, all the different itises, you can normally track it back to problems with the gut. I always make sure when I have a patient and I ask about their gut and I say, how is it? And if they say fine, I always say, well, tell me, what do you mean by fine? Because most people don't even realize what a normal functioning GI tract looks like, because most of us do not have functioning GI tracts. But if we have allergies and asthma symptoms, the first place to start is at the gut. And if that's not functioning, if we don't start there, then we're just band-aiding our symptoms with medications. But that's the very first place to look.
I only wish that you were my doctor years ago. When I was a young grade school person, a lot of people listening to this program, I've actually never even spoken about it before, because this is really, quite honestly, our first focus show on just allergies. But what a chronic thing I suffered with. I mean, we're talking about acne. I certainly had that. I certainly had cold medications, and what was associated with, I was told all the time by the quote-unquote medical experts that, hey, it's just some seasonal allergies, but in all realities, it was a spring allergy that went all through the summer into the fall. I mean, it might have been the dead of winter where it was more calm, but I certainly had stuffy nose and I certainly had the acne always. But when I look back now, I mean, changing the way I eat and the way I take care of myself dramatically, nobody ever said back then, hey, slow down and think about this. The quality of the food that you're eating is creating an environment inside of you that is pure poison. It's toxic. I mean, Dr. Jen, I was eating anything and everything. I was eating whole pizza pies. I was eating fast food. Sure, I ate at home as well, but my point is there was no thought back then about how food might be affecting my skin or my nose or my eyes or my clogged ears, because I had no doctor ever saying to me, this is what's going on.
And that's correct. Even people that have, when they say, oh, it's just seasonal allergies, like it's a very benign situation. Not everyone develops seasonal allergies. And if you look at that, why doesn't everyone develop seasonal allergies? People that have seasonal allergies, there's other things going on. They've been over-toxic. Their liver is overburdened already. And if you're having seasonal allergies, I would highly recommend trying to rebalance the body out to reach homeostasis so that you don't have seasonal allergies. That's good insurance or good assurance for future to kind of secure that you might not develop future inflammation, because if you don't keep that in check, more than likely in the future, other inflammatory type of disorders can start brewing.
I find also something else that you said is very true, and I see this as the heart of the problem or the matter, is that people feel like, hey, I'm fine. I don't have any inflammation, because they think of inflammation as some sort of, God forbid they fall and they have a massive swelling or they have some serious disease. Maybe then they would say, oh my God, my body is really inflamed, or I have bursitis, or I have arthritis. Okay, fine. But when I say to them, oh, you're inflamed, after giving them breathe in and out through one of your nostrils, close down one side of your nose, shut your mouth, and try to breathe in and out through one side of your nose, and then now do it over the other side. Oh, wow, I can't do it on one side or on either side. I'm totally clogged. I said, guess what? You're inflamed. It sort of blows their mind, but I wanted to get your comments on that. I mean, right there is proof positive that, man, you're swollen inside.
I think the one point that needs to always be made is just because you're having the symptom in your nose doesn't mean it's just coming from something you're inhaling, or should not be reacting to pollen. You shouldn't be allergic to grasses and all these things. Your body have our livers, and we have an amazing symptom so that we shouldn't be allergic to nature, to our environment. It's the other man-made chemicals and the lack of nutrition and the stress, which leads to lack of stomach acid, which means more infections. It's a lot of these things that are interrupting our immune system. So just because it's in one area of the body doesn't mean that what you're doing in other areas isn't causing it.
Yes, of course. That's why I wanted you to talk a little bit about, for a few minutes, what actually causes the allergies, because I'm so glad you was like you were reading my mind. With so many times people think, oh, they've been told by a doctor, by a professional, they know better than me. Oh, it's a seasonal allergy. Like it's only understandable. What could you expect? That it's springtime and you're supposed to have trouble breathing and you're supposed to have trouble seeing through your eyes because they're so filled with water. But that's not really it. It may be triggering something, but what you're really talking about, Dr. Jen, is the body is already polluted, right? So can you describe that a little bit more? What exactly is breaking down in the body? Which, again, I hope people, when they're listening to this, they don't get discouraged, Dr. Jen. I find a lot of this information to be very empowering. It's exciting because when you find out what's really going on, now you can go after it. You can start cleaning up things and feel a whole lot better and lose those allergies like I did. So please talk a little bit about what's breaking down that then causes those allergic symptoms.
The cause of allergies is definitely multifactorial, and one of the things you have to start, or the place I first look at is removing the obstacles to cure, meaning what things are we putting into our bodies that aren't meant to be there that are creating toxicity? So one of the things that causes allergies to develop is an accumulation of waste or toxicity in our tissues. So the first thing you want to do is remove the toxins from your diet, the environmental toxins that we clean with, the spray starch we iron our clothes with, the food additives in our food products. We want to remove that. And so that's the first step. So when you also want to address toxicity, you want to make sure that our organs are working properly, right? One problem is our sedentary lifestyles these days. Sure, exercise is great for burning calories and all these things, but people need to realize that our bodies are meant to move. That's what stimulates our lymph system, for instance. You have to move your body so that all the lymph is moving and toxins are being taken from the cell back into the blood and then flushed out of you. If you're not moving, you're going to be toxic and you're going to develop arthritis.
With my master's study in exercise physiology, exercise has always been a big part of what I do. And I find that a lot of people don't realize what you just said is simply at the core of why most people feel better when they move, because their bodies have become, over years and years, more sluggish, more clogged up, if you will. And then when they get moving a little bit, in even a very gentle way, they just feel a little bit more alive and invigorated. I think that's what you're describing. The circulation gets going.
So removing the toxins and making sure that our organs are properly working, is how allergies develop. So these toxins is one of the biggest problems. And also, nutrient deficiencies. So, nutrient and phytochemical deficiencies, the things in our food that, most of the time are lacking in processed food. Our nutrients in processed foods, even the ones that are fortified, we don't absorb those very well. But you need nutrients to detoxify. Your liver needs them to detoxify. And, if you have any sort of deficiency, you're going to become more toxic. One thing I always like to tell patients, they'll say, well, I'm only drinking 12 ounces of soda every day. That can't cause a problem. And Jonathan, it's like they hear, well, it's empty calories. Okay, it's empty calories. Which means you're not getting the nutrition from it. Fine, but it's more than just empty calories. It's because your body then has to process all of that sugar, and it uses nutrients to process it. Nature is, soda's man-made, not properly formulated for us to metabolize. So when you eat an apple, it has everything in it for you to process that apple without depleting yourself. Anything that's man-made is not like that. So most of the things that, you and I were probably both raised on, has depleted us. And that's one of the causes of why not everyone, but a lot of people these days are experiencing chronic inflammatory disorders like cancer, allergies, and asthma people are suffering their whole life with. But toxicity and lack of the ability to detox through nutrient deficiencies, are probably two of the biggest.
And let me just get your comment on this, Dr. Jen. I also see how the two are connected with each other. In my mind, I would think, and again, this is sort of to give the alert to people to not take such a relaxed approach like, well, I'll just, the doctor says I just get all my nutrients from food. Don't worry about supplements or anything. But the point is, if you're under a lot of physical, emotional, or mental stress from a lack of nutrition, or, let's get real here, you've been exposed or polluted yourself in one way or another with holiday parties or, different events that you go to, you've had too much alcohol or some really bad food that you ate the week before or just yesterday, that there is a greater demand that your body has for nutrients that are going to sort of help you along with all of this stress. So here it is, we're undernourished, we're toxic, and we need more nutrients, and somebody's just sort of thinking, well, tomorrow I'll just get, I guess, everything I need from that bowl of salad for lunch. That's really not going to do it.
Right, exactly. The reality is our lifestyles are limited. Americans in general do not live very healthy lifestyles. There's so much demanded from us. We're go, go, go all the time, which is a stress. Even if it's not a negative, no, we're not sad. We're not, people think stress always has to be a negative. If we're constantly go, go, go all the time, we're eating on the run, we're not taking our time, we're not stopping to smell the roses every now and then, we're under stress. We have, and then we secrete a lot of cortisol, and then you have the cortisol insulin response. We become insulin resistant. We start storing more fat. Fat itself secretes its own inflammatory signals that creates inflammation in the body. And, fat stores toxins. So, we become more toxic. It's almost like a lot of us are just stuck in this hamster wheel, and we just, what I try to do is trying to direct them out of that wheel.
Dr. Jen, I think we should shift our attention for the next part of this program and really talk to people about how we can help those that are suffering with allergies to heal. There's many ways, right?
There are many different ways to heal, and everyone is so unique. That's why every patient is treated differently. So everyone is very, very unique. However, there are probably, I would say, 5 points that I always address. So the 5 points are good diet. Good nutrition, good phytonutrients is number one. Different patients, I might recommend different dietary regimens. So everyone's a little different. Diet, detoxification is important, exercise, meditation, stress reduction, and probably another one, the last one, would be strategic supplementation based upon that person's individual biochemistry.
So when it comes to these toxins, though, that are in people's lives, let's say for the particular individual that you really see as being, just inundated. They're really polluted. Yes, on one hand, you're going to tell that person, hey, maybe they're exposed to a lot of sprays or inhaling a lot of toxins and household cleaners, or maybe at work they can protect themselves a little bit better and minimize it. But again, I'm still going back to the same thing, Dr. Jen. We're talking about somebody who's filled with a lot of toxins. What are some of the things that you would introduce to those people on a practical level that they can do to help detoxify themselves, or perhaps things that you even do at the Riordan Clinic to sort of accelerate the healing process?
One of the best things to implement, especially people that are over-toxic, I'm talking because we see very, very inflamed, toxic patients that, I certainly can't tell them, you need to go out and start exercising 3 times a week. Realistically, that'd be great, but they're not there yet. One of the things, to be honest, that we like to start implementing here at the Riordan Clinic is intravenous nutrients, intravenous vitamin C, intravenous methylcobalamin. All of these things help the liver detoxify, help the body heal, the cells properly heal. And so that's something that they don't actively have to do, so it kind of helps build their body up so they can start developing the energy to start doing the things that they need to do to change their lifestyles. Not everyone has access to that, so we can't always start with that therapy, but that's one thing that we really like to utilize here at the Riordan Clinic.
What about with people, say, at home right now who obviously may not be able to go to Wichita, Kansas, to the Riordan Clinic? But again, what we are talking about here, and I think it's a very valid point, is that they're doing things in a very passive way. It's a very relaxing way to sort of clear away the toxins, Dr. Jen, because like you said, once that's established and the person experiences a greater sense of energy, not only physically, but mentally and emotionally, they feel more uplifted. Now it makes sense. Now they get excited to maybe do some sprouts at home, some home gardening. Maybe they want to start walking, but we're still talking about the person who's inundated and drowning in toxins. What would you suggest to those people to help sort of clear the pathways?
Okay, so like I first stated, the first thing is to remove some of the toxins. So a lot of these patients, we can give them oral supplements. I can have them start doing things, but they're not going to feel better if they're still getting a lot of toxins. So one of the easiest things I have patients do, and Jonathan, I've had patients do this one thing I'm about to tell you, and they've done complete 180s. I've had patients' migraines go away. I've had patients, life change just by, I have a list of 12 of the most dangerous food additives, and I have them remove that. I say, go home, look in your cabinet. If you have anything with this food additive in it, remove it. Next time you're at the store, read the other labels of the other brands and find a brand that doesn't have it. And even at Walmart, you can find it. And I have that list on another YouTube video that anyone can watch on our website. But that's one of the first things I have every patient do, because that alone is so simple. They can control it for the most part, that they can see a huge benefit, and their liver can start detoxifying. That's the first thing that I have patients do. Another very simple thing to help the body detox is, as silly as this sounds, deep breathing. And it's not just the oxygen that helps detox, because that certainly does, but our major lymph gland is right under our diaphragm. And most of us hold our breath. I bet you a lot of the people listening right now are holding their breath while they're listening. When you're stressed or you're hyper-focused, you hold your breath a lot of times. And so that deep breathing can actually start helping the body detoxify. That's why meditation can be so wonderful for healing, because it helps the body detox. So that's probably the second easiest thing for patients to go at home to start doing. The third one, drinking water, filtered water. Replace all your sodas and juices and sugared type of drinks with pure water. You can't detoxify. Your biochemistry cannot function if you're dehydrated, and most of us are at a very low chronic level of dehydration.
And, we're going to be doing entire programs dedicated to this, but I wanted to sort of throw out there a few other ideas as well. When you say water, most people, again, we're generalizing for a radio program. We can't exactly treat each person individually like this. We all get it. But the idea is that a lot of people that are highly allergic and they're dehydrated, they have to move up their water. But what about things like juicing and just doing smoothies and maybe easier to digest foods to help their body sort of unclog this inner congestion? And also, I'd like you to speak to the idea of far infrared sauna, something like that as well. Again, relaxing, doesn't physically take a lot of stress. Can you speak to those things, how that might be helpful?
Even better than juicing, Jonathan, that I really like is blending, where you actually blend the whole food, so you make sure that you get all the phytochemicals that are in the fiber of the food, because sometimes when you juice, the phytochemicals are flushed out. So juicing and blending can help the GI tract start healing, so it's not having to break up all the food. It's not having to work quite as hard, so it can start healing. Juicing and blending is going to help the digestive tract heal, as well as help, of course, you can get more servings of the good stuff in when you're juicing and you're blending. Far infrared sauna is another great therapy that people can buy home units, keep in their homes and sit in. So far infrared sauna really helps simulate detoxification as well.
So shifting gears, Dr. Jen, a lot of people at the beginning, they're going to say, okay, maybe I'm allergic, maybe I'm not. This is a little confusing for me, but I am very motivated to take care of this. I want to connect with a healthcare provider, someone like you, to help me with this. But are there any kind of medical tests that you actually do that, in my mind, Dr. Jen, I think that is a critical part at the beginning to get people really grounded and focused, because it's like, here's your test, and then here's your numbers, and it's great biofeedback, if you will, right? Hey, we're improving these tests. Do you see how you're feeling better? Do you see how these numbers are doing? It kind of helps people to get more excited and more motivated to stay on the program. So do you have any tests to suggest that you do in your practice?
One of the best tests to have run to see if you have a lot of inflammation is going to be something called C-reactive protein, the high sensitivity C-reactive protein. It's just a marker. It doesn't exactly tell us how to treat the patient, but it's a fantastic marker to run to show, yes, you have inflammation. And it's also a great marker to track over time, because it will change over time, as a patient gets better. So CRP is a great, I guess you would call it, diagnostic marker and tracking marker.
What kind of number is sort of normalish, and what kind of numbers are like, whoa, it's a little bit off the chart?
Right. So, if you do, there's two different CRPs. You want to do the CRP High Sensitivity one. It's more sensitive, and anything over 1.9. So anything 2 and over is considered high. So, to kind of give you a perspective, people with allergies and asthma, I could see it in the 20s. Autoimmunity, 40s, 50s, 60s, people with rheumatoid arthritis and lupus and cancer sometimes, you will see 100, 200, 300. So really, really, really high. So that's a great preventative marker to track. Actually, this is probably even better. One of the first markers of inflammation, if you really want to get preventative, is ferritin. And that's iron storage. And that's considered the first marker of inflammation. Now, of course, these are labs tests. Not every single person is going to have a high ferritin. But for the most part, ferritin's a great marker to track.
And what are those numbers? What are those numbers for ferritin to give people a sense, in case they hear it?
Anything, like for a woman, anything over 150 is considered elevated. For a male, 250 to 300 would be the high end of normal when you're looking at a ferritin level. So those are two great tracking labs. Other labs that can help you treat, a patient and figure out, the underlying cause of the allergies are going to be, there's a whole lot of labs. But one I always like to look at is, look at the adrenal function of a patient. How are their adrenals working? How high is their cortisol? Are they very low in cortisol? Looking at the adrenals and the blood sugar and insulin is a great labs to run. We of course do nutrient testing. Fatty acids, omega-3 fats, looking at the omega-3 to omega-6 ratio in the blood. Vitamin B6 and zinc, extremely important for allergies, and magnesium is another one. Thyroid testing, of course. When you do, you want to do a full thyroid panel. So you want to also do a free T3, which is active thyroid hormone, and you want to do a reverse T3, which is considered thyroid blocker. And you want to look at both of those and look at the ratio. That'll help tell you how inflamed you are. And, if that's not balanced properly, then there's some underlying metabolic issue going on that we need to work.
And again, tying back to the emotional side of things, and we're going to really get into this in 2014 in some of our programs. Of course, not all of them. It's important to understand the nutrients and how to detoxify and all of these other shows that we're going to do here at the Natural News Talk Hour. But I find that when someone just looks at one thing only as sort of like their fail-safe, it's their magic bullet. Hey, I'm just going to make sure that I eat only organic food. This is going to do it for me. But they're coming from a place of dis-ease, really serious allergies, and they're agitated and they're emotionally upset, that they should never forget some of the things that you've mentioned in this program about meditation, deep breathing, sort of the joke of smelling the roses, as long as you don't have too serious an allergy to roses at the time. But the idea is just to relax a little bit more and to be more mindful of your response, your mental emotional response to things, because you could eat all the organic food in the world. And again, this is just my opinion, but I've seen this in people where they're so upset that after a bout of upset, they are wiped out for the rest of the day. And yet those people, I know for a fact, were eating very healthy foods, but it was the emotional outburst that really knocked them for a loop. So, your thoughts on that, Dr. Jen?
That's a very good point that you're making. And I actually have this little visual chart that I give patients, Jonathan, that talks about alkalinizing the blood and, acidifying the blood. So that's kind of something that's out in the literature right now. But we want to be more alkaline. The more alkaline we are, the less inflamed we are, right? So, I have patients come in all the time asking about this. So I made a chart, and they're always so focused on the foods, the things that they can easily, change. But on my chart, I have listed the foods that are acidifying, the foods that are alkalinizing. But at the very top, I have emotions, the emotions that are alkalinizing and the emotions that are acidifying. And, if we can change our diet, we can change our environment. So if we don't change our thought process, if we don't change our attitudes about the world and life, help our relationships, if we don't help ourselves, all of our thoughts and our reactions to things, we are still going to be in a state of dis-ease. Our body is going to be acidic. And, that's something people forget as the underlying issue for a lot of people with chronic illnesses is that they have not addressed either, a toxic emotion, a toxic past, a lack of a spiritual foundation, whatever that is. Those are big things, Jonathan, that are not always, I shouldn't say that word, but usually ignored in the current health system.
I agree with you 1,000%. I mean, this stuff has been out there since body-mind medicine has been around. Dr. Herbert Benson, Dr. Joan Borysenko, and Louise Hay. And I mean, all of this stuff from, the 50s, the 60s, the 70s, the 80s. This has been in the background for a long time, but it's still, it's growing and it's changing the consciousness of the fact that emotional well-being is so important and that it will, I absolutely agree with you, it will override all the quote-unquote healthy stuff you do if you still don't have that thankful feeling when you open up your eyes in the morning, the appreciation for someone in your life. I mean, if it's not a significant other, a spouse, whatever, there's a friend, there's a teacher you've had that you're just so grateful for, that feeling of gratitude, the feeling more of forgiveness and compassion. These feelings, in my opinion, they're very alkalizing, right? They're quote-unquote healthy. And if we're just like jealous and greedy and feeling like we're lacking and, we just want more and we're in a rush to get better and we're angry that we're not well yet, which again, respectfully, I understand that feeling. You're feeling lousy and you just want to be better as of yesterday, but that feeling of anxiousness in your mental, emotional pathways, if you will, that stuff can cause a lot of acidity and a lot of dis-ease.
Even the simple fact of being chronic indecisiveness all the time can create disease in the body. So, another point, one thing my dad's a doctor, my grandfather was a doctor, and my dad always said, my grandfather said that one of the best ways to treat a patient, and something that, was being lost at the time my dad was going into medicine, was visiting the patient's home, learning about the environment that they're living in. Really helps a doctor help a patient better. So always looking and asking about, the environment, the relationships, and that's kind of what he meant by that. All of that is so important to help a patient. So,
Dr. Jen, to close out the program, as if people were maybe not paying attention the whole time, which I really doubt with our listening audience, they're sharp, they're bright, they're fantastic people. I mean, I really mean that from the bottom of my heart. I get emails every single day where people are so appreciative, they're inquisitive. I mean, it's just a great group of people. But what would happen to someone out there who just sort of, it's a nice show, it's allergies, I've got some, whatever, I'll just do the best I can. What would you say in closing are some of the things that tend to spin off, if you will, and get created on top of ignored allergy symptoms?
Oh, gosh, Jonathan. I see patients later on in life when they've had a real bad chronic illness. And most of the people that I see with cancer and debilitating autoimmunity, you always look back at their past. I look back at every little event, what happened, when it started. And all of these people, I don't think there's maybe one or two, but they all lead back to allergies and asthma in their early childhood. So if we don't get the inflammation under control now, these get worse and worse. Your allergies, your seasonal allergies and asthma might turn into arthritis. Then your arthritis, can turn into colitis and bowel problems. And in females, you start seeing things like endometriosis and ovarian cysts. And then that leads later in life to, breast cancer. So if we don't catch it early, more than likely the inflammation just builds and builds, and our cellular biochemistry gets more imbalanced. Our bodies just break down. So what we want to do is start focusing on this very early so that we prevent, a lot of these degenerative diseases.
Dr. Jen, I want to thank you so much for your time. And I want to thank our listeners for joining us today. For more information about Dr. Jen or the Riordan Clinic, visit riordanclinic.org. I'm your host, Jonathan Landsman. I hope you enjoyed this program. Thank you for your support. Talk to you soon. Take care.